Welcome to the Environmentalist Nurse, the podcast exploring the intersection of nursing, public health, environmental health, and climate action. I'm Dr. LaDonna Gaines, and each month you'll hear conversations with experts and practical insights to help healthcare professionals protect both people and our planet. Let's get started. Welcome to the Environmentalist Nurse podcast. I am your host, Dr. LaDonna Gaines. Today, we will be kicking off Season 2 with a solo episode. I'll be talking about PFAS. But before we jump into today's topic, let's talk a little bit about what has transpired since last season. First, I'm so glad I was able to come back with another season after such a long hiatus. As discussed in the Season 2 teaser, I've added some new segments, which I hope you all will enjoy and appreciate. So, in the spring of 2025, I took on the role as the Alliance of Nurses for Healthy Environments Regional Forum South organizer. This region includes the states of Alabama, Arkansas, Louisiana, Mississippi, Missouri, Oklahoma, and Texas. The goal of the regional forums is to strengthen the A&E community by hosting regional webinars or speakers, having meetups, partnering with community-based organizations, and more. If you are in one of these states, please join the South's Regional Forum. I'll leave the link in the show notes. If you are in another state, I'll also leave a link for where you can find your specific forum. Every region has an amazing leader or even two. Now, I believe I mentioned the fellowship before, and A&E was able to have a fourth cohort this year, and I'm serving as a mentor a second time. And I really do enjoy working with A&E. If you haven't joined yet, I highly encourage you to do so. If this is your first time tuning in and you don't know what A&E is, here is their mission. Support nurses in promoting planetary health and equity globally by educating and leading the nursing profession, advancing research, incorporating planet-safe practice, and influencing policy. So A&E is a great nurses organization centered around environmental health. And now a little bit of information about the fellowship that I just mentioned. The fellowship that A&E has is intended to train nurses to work with communities in tackling serious environmental health issues with an emphasis on climate and health equity, as well as to provide them with mentorship and skills-building opportunities so that they can take on increasing leadership roles in the communities that they serve. And so I was in cohort 2 of A&E's fellowship, and it was a wonderful, amazing experience. I was a mentor for cohort 3 and now again for cohort 4. Being a part of this fellowship is a lot of the reason that I've been able to do some of the things I've done and be more involved with A&E and environmental health issues and groups. So it was an amazing experience. And if they open up applications for another cohort, I'll try my best to remember to let you all know about that. Now that I've caught you up, let's start with a quick look at a recent climate and environmental health headline. The climate health headline that I would like to talk about today was published in the New York Times on June 25th. And what it discusses is that there was a federal settlement with a chemical production company. It is valued at $450 million. The settlement addresses PFAS releases affecting communities in West Virginia, North Carolina, as well as New Jersey. While it does include funding for pollution controls and drinking water projects, North Carolina leaders have raised concerns that the agreement does not adequately address the state's contamination and cleanup needs. So right now, it's too soon to tell if there will be anything more added to the settlement based on these concerns. These were just some concerns that were brought up. Now, let's turn to today's main topic, PFAS. The reason I chose PFAS as the season opener is I recently took a CME called Non-Stick Nuisance Medical Monitoring for PFAS. It was really good at breaking down PFAS and what healthcare providers should do. The CME included very compelling stories of those who have been directly affected by PFAS. I'll leave the link in the show notes so that you can check it out. As of the time that I'm recording this podcast, which is July 3rd, this group is still doing focus groups and interviews with healthcare providers and students who are enrolled in certain healthcare majors like nursing and public health. A&E has an awesome PFAS toolkit that I happened upon after doing the CME, and I'll also link the website for the toolkit in the show notes as well. So, what are PFAS? PFAS stands for per and polyfluoroalkyl substances. They are often called forever chemicals because many of them break down very slowly and can persist in the environment and in people's bodies for long periods of time. There are thousands of them available. It's crazy. They've been around since the 1950s, and they are in several everyday items like food packaging, cookware, firefighting foam, carpets, and clothes. Another common way people are being exposed is via contaminated drinking water. There are those that can also be exposed via their occupation, especially those who work in industries like construction, aerospace, automotives, and electronics. Now, I would like to briefly mention two specific PFAS, PFOA and PFOS. These are two of the most well-known PFAS chemicals. PFOA stands for perfluorooctanoic acid, and PFOS stands for perfluorooctane sulfonic acid. They were used for decades in products designed to resist water, grease, stains, and heat. And that includes things like nonstick cookware, coatings, stain-resistant fabrics, food packaging, and the firefighting foam. So, although many U.S. manufacturers have phased out PFOA and PFOS, they are still found in the environment because, as mentioned, they break down very slowly. Also, they can contaminate soil and drinking water, particularly near industrial facilities, including military installations, airports, and locations where firefighting foam has been used. PFOA and PFOS are sometimes called legacy PFAS because their use has declined, but of course their impacts remain because they're just going to be around for a while. So why should we be worried about these chemicals? There is a lot of data and research to suggest that exposure to certain PFAS has been linked to several types of cancers, dyslipidemia, pregnancy-related problems, vaccine resistance, and more. Research is ongoing, especially for lower-level exposures and long-term exposures. Blood testing is available for PFAS, but it is not always easily accessible, nor is it required to be covered by insurance. There is a PFAS blood estimation tool for those that have been exposed to PFAS via drinking water. The process should start with the PFAS exposure assessment questionnaire. The estimation tool can be used to help determine ways a person may have been exposed to PFAS, how they can limit those exposures going forward, and what to discuss with their healthcare team if deemed necessary. Of note, this blood estimation tool is not a replacement for actual blood testing. If someone does get the blood test, it is important to know that the blood test is very limited. There is no way for it to tell you how you have been exposed, if you will have certain health problems in the future, and it only tests for a handful of PFAS chemicals. So, it's important to work closely with healthcare providers once test results are received to determine next steps. So, these are things to keep in mind when you're speaking with patients or you're helping a physician or practitioner with someone that may have these concerns. So, to wrap up, what you need to know to keep your families, patients, and community safe is that PFAS exposure can happen through what we drink, eat, breathe, touch, and bring into our homes or workplaces. For many people, though, exposure is low and comes from multiple sources, all those things that I've mentioned before. But for people living near a contamination site or working in certain occupations, one pathway, especially the contaminated drinking water, may be much more significant than the multiple exposures. The best thing to do right now, and the best way to educate your patients on this, is to let them know to check their drinking water information, follow fish advisories, reduce occupational take-home exposure, and choosing PFAS-free products when replacing items anyway. So if they work in one of these occupations, they may want to change clothes before going home. They may want to wash up at work. They may want to use PPE. Again, all of this just depends on, kind of what they do and how they're being exposed. And then if you're replacing cookware or those things anyway, check the products to make sure they are PFAS-free. PFAS can feel like a big and overwhelming topic, but there are practical steps we can take to better understand exposures and reduce risk where possible. So here are some practical takeaways. PFAS exposure has been linked to several health concerns, including several types of cancers, but a blood test cannot diagnose a PFAS-related illness or predict what will happen to one person in the future. If patients have a known or likely exposure, especially through contaminated drinking water or their work, they should discuss their exposure history, whether testing makes sense, and practical ways to reduce ongoing exposure with the treating provider. This is where you as a nurse can really advocate for them and their need for testing based on their history. As a reminder, testing is not free and may not be covered by insurance depending on where you live or your specific insurance company. Now, I would like to highlight a resource that goes even deeper into information about PFAS. It will help you learn more about them and the communities most affected by these chemicals. So, the resource spotlight for this month is the PFAS Chronicles podcast. It was published in September of last year, 2025, so it is pretty recent. It is a 5-part series that does a detailed analysis of PFAS in the United States. All of the episodes, except one, are less than 30 minutes in length and give great information on several areas dealing with PFAS, like the cost on health and the economy, occupational effects, and monitoring. Episode 3 was especially compelling to me. Stories really show kind of how people are affected and how it pushes them to places they never thought they would go. The link for the podcast will be in the show notes. Even with the challenges PFAS contamination presents, there is still progress happening through research, community advocacy, and policy change. So I'd like to close out with a little bit of hope and action. There are state and federal laws in place for certain items. At the federal level, drinking water PFAS rules exist, but the landscape of this is changing. EPA's 2026 proposals would keep the standards set forth for PFOA and PFOS while proposing changes to standards for 4 other PFAS and possibly allowing compliance extensions. So, a few examples of what's happening at the state level. We have Minnesota that prohibits intentionally adding PFAS in cookware. And then in Connecticut, they currently require product labeling, and they're moving toward a broader ban in 2028. And now it is time for the Environmentalist Nurse prescription, which is one evidence-based action you can take this month. This month, I'm prescribing this evidence-based action that I've already mentioned. Check your water source. You can do this by contacting your local water utility to check for PFAS testing results or to actually request testing if it is a public water system. This will help you determine if there is mitigation you can recommend to your patients, like water filters. Of course, you can use this same information for your own home. Of note, private well owners may need to arrange their own testing through a certified laboratory. So I didn't go in depth about mitigation things. This is more about what PFAS are and why they are concerning to you and your patient's health. Listen to that podcast that I recommended. Look at that toolkit, take that CME, and you can get even more information about PFAS. Until next time, remember, caring for the environment is caring for our health. Thanks for listening to the Environmentalist Nurse podcast. If you enjoyed this episode, subscribe, leave a review, and share it with a colleague or two. Together, we can create healthier communities on a healthier planet. Until next time, stay curious, stay informed, and keep advocating for both people and our planet.